Good morning, everyone. Welcome to today's live update. I'm Chancellor Donde Plowman. Tomorrow will mark 1 week since classes began. I've seen so many students and faculty practicing social distancing, wearing their masks, and doing their part to protect our campus and our community. But we still have some who are not upholding the commitment they made, and those decisions have much broader consequences. We're attempting to do something this semester that has never been done before, and it is hard, but I continue to believe that we can succeed this. It will take everybody's buy-in and cooperation, and we have to keep working towards that. This morning, I'm joined by Provost John Zomchik, as well as Dr. Spencer Gregg. And we're going to cover 4 things this morning. First, as usual, we will start with the latest data related to case counts and isolation. Our second, where I want to talk about our first disciplinary procedures related to endangering the health and safety under the Student Code of Conduct, how that work is continuing. 3, I'm going to answer, I hope we can answer more questions about self-isolation and quarantining, what that means, what is expected of students who are in that situation, how it happens. And finally, an update from the provost on instruction during our first week of class. So let's pull up the graphic, and I want to reiterate that this information is on our coronavirus website, and it's updated every weekday morning. So let's look at the first graph, which we always start with, and that is, somehow I lost it. There it is. Okay, excuse me. Okay, we start with the number of active cases. So what you see here is there are 126 active cases, COVID-19 cases on our campus. 120 of them are students, 6 are employees. So the line is continuing to go up. I want to just to clarify something that over the weekend for 2 or 3 days, our numbers were a little bit inflated because somehow we had a little glitch, and the numbers of positive cases included confirmed positive cases as well as those awaiting the results of their test. We have taken that out of the data just to make sure that all the way through we're never looking at apples and oranges. So the numbers that you see here, 126 active cases. In the next chart, what you see is we now have 489 people in quarantine or self-isolation. If you look, that part of the bar graph on the bottom is employees. That continues to be level to slightly downward slope. The green bar is the number of students who are students living in the dorms who are now self-isolating. And that green number is 122 students. Now, the majority of those, the large majority of them, are self-isolating at home, which we think is advisable unless there's a member of the family who is at high risk. And the large part of that bar chart is off-campus students who are self-isolating. And in a moment, we're going to spend some time talking about what is expected of each of those 2 categories of students who are self-isolating, because that's really important to our ability to be able to bend this curve. As Dr. Gregg mentioned last week, we don't like seeing these numbers go up. So we're continuing to work hard at getting them to take a turn. So 126 active cases, on 120 of them being student. And then what you see here is the self-isolation. I continue to look very carefully at all of these numbers, as does the entire policy team, keeping an eye on that self-isolation, particularly of on-campus students where we have set aside rooms for them to isolate. So let's talk for a minute now about, I want to talk specifically about the next point I want to address, and that is responsibilities and consequences for all of our behavior. And let me just say that everyone should have received yesterday either an email, the students received an email from me, and the campus got an update. I sent an email to students, informing them that we have initiated disciplinary action against 4 students. 3 of them were hosts for off-campus parties, which, as I talked about last week, we need that to stop, and that we will hold hosts responsible for jeopardizing the health and safety of people who attend those parties if there are no attempts observed to social distance or the wearing of masks. 3 of those students hosted off-campus gatherings with no social distancing or consistent mask use. The other student knew they were COVID-19 positive, but knowingly left self-isolation together with others off campus with their friends. If what was reported to the university is accurate, these students face suspension and perhaps even greater penalties. Suspensions means delaying your graduation by up to a year at a minimum. That's a pretty severe consequence for hosting a party where people were not able to maintain social distancing or mask themselves. We've received a number of photos and reports to student conduct, and we're also working through a number of those, the reports about gatherings that are in violation of the student code of conduct. We will work hard to hold these party hosts accountable in the same way. So that work continues. We've received emails, and I want to speak to this for a minute, social posts, questions into the online portal about what to do when you see unsafe gatherings on or off campus. So let me clarify who's doing what. UTPD, University of Tennessee Police Department, addresses legal violations such as violations of the law or municipal ordinance, things like underage drinking or open containers or noise. Those are the things UTPD is consistently asked to call upon because those are violations of either law or municipal ordinance. Activities that violate the university health and safety requirements, such as limits on gatherings, those need to go through, and they do go through, student conduct. You can report both of them using the Live Safe app, and that's what we would encourage you to do. Frankly, some of the photos that I've been seeing are deeply disappointing, and they threaten our ability to maintain the campus experience that hundreds and hundreds and hundreds of students have written me asking that we be able to maintain the student experience. That's all in jeopardy if this business continues. We will continue to hold students accountable to the student code of conduct. I've had any number of students writing me since the email yesterday saying, thank you, please, I don't want to have to go home again. Other people, alums, saying, thank you, we want football this fall. Thank you for doing it. We will continue to take a hard line and ask everyone to do their part. So we've talked about what we shouldn't do. Let's talk about what students can do, because connecting and socializing is part of what we all want to do. We're social creatures. But how can we do that and stay safe? First of all, my first recommendation is outside. Be with your friends outside, not inside, crammed into a small apartment. Do it in small numbers, less than 10 people. Outside, where you can easily stay distanced from each other, is a safe way to stay in connection with each other. Maintain your social distancing. We know if you wear a mask and stay 6 feet apart, you can stay safe. Student Life is working to provide some safe options in person, online, and hybrid. So let me say it again. I know this isn't easy. We're all tired of it. And it isn't the way any of us want to experience our fall at college. But if we continue to have on-campus experiences this fall, if we want to continue to have on-campus experiences, if we want to have a football season, if we want some of the major things that make this a college experience, everyone has to take these safety precautions seriously. Let's talk about the third point. I want to talk about quarantining and isolating. I'm going to really ask Dr. Gregg to help us with this. So just as we talked about contact tracing last week, I want to talk specifically about what does it mean to quarantine and isolate. If a student tests positive, is symptomatic, and waiting for test results, or has come into contact with someone who tests positive, They need to separate from everybody else by either isolating, that's for people who are sick, ill, I for ill, or quarantining for people who might be ill. For students who live on campus, first I want to talk about what we're doing for them, and then I want to talk about for students who live off campus because the situation is different. So let's talk about students who live in the residence halls, as well as sororities and fraternities. We have isolation and quarantine housing for those folks. So what should a student expect if they have to move to an isolation space? First, a university housing staff member or sorority or fraternity staff member will reach out to the student by email with instructions and a list of resources. Second, the student will receive a comprehensive email with instructions on how to access keys to isolation spaces, how to get in, where it is, how to arrange for transportation. We have people who will drive the student to, if they need to the new place. And most of them will need to be driven because we're going to ask you to take enough things for 2 weeks. There's instructions about how to get your meals and how to get on Wi-Fi. Third, we will work with you and help you. And it's important that you read all of your email. So to that subset of students who live in the dorms and who need to quarantine or isolate, those are the things that we're expecting and services we're providing. So let me ask Dr. Greg, help me with this. So what does isolation mean? So if I am isolating, can I go to the store? Can I go to class? Can I do anything? So what does it mean?
So isolation is intended for people that we know are infected or having symptoms that are suggestive of infection and know that they're infected by a positive COVID-19 test. Those individuals are on stricter limitations. If they live in let's say they live off campus in an apartment or maybe at home with their parents, when they're in isolation, we're asking them to remain primarily in the bedroom that they sleep in and to use a bathroom that is solely dedicated for their purposes. If they have to share a bathroom, which is not preferable, but if they do, then it needs to be cleaned after each use. By doing that, that individual that's in isolation can avoid contact with other people in their home, and therefore they are less likely to be identified as a close contact. Anytime that you're infected and you should be in isolation, if you're sharing a living space, living room, kitchen, then you're posing a risk of infecting those other individuals. So those household contacts would then be referred to as a close contact.
You want to distinguish again for us between isolation and quarantine because they get those terms interchanged.
Sure, and it is, when we started all this, we really talked in terms of self-isolation because we didn't want to use the terms isolation and quarantine because they had kind of medical or public health meanings. But I think now as we're moving more into this phase, it is important for people to understand the difference. Isolation, typically, again, it means you're ill or infected. And in general, one could anticipate that isolation will last for a duration of about 10 days. Usually that's a minimum. There have been some recent recommendations put forth by the CDC and the Tennessee Department of Health that may, in some cases, limited cases, allow that isolation time to be less than 10 days. But typically, most people are going to be in isolation for 10 days. Whereas quarantine is typically thought of for individuals that are identified as asymptomatic close contacts of someone that is infected. Again, a close contact being someone that's been within 6 feet for more than 10 minutes of someone who's positive for COVID. And so an individual in quarantine has to stay in quarantine for 14 days, and there's really no exceptions to that. And the reason the 14 days is there is that, it seems odd that someone's infected could potentially be released to come back to work or class before someone who's just being monitored because they might get infected or might develop symptoms of infection. But the reason is because the incubation period for this infection can potentially be for up to 2 weeks. And so that's why that quarantine period lasts for 2 weeks, and that's why it's mandatory and not an option. So if you've been identified as a close contact, it's pretty much meaning that you're going to need to be in quarantine for a period of 14 days. In quarantine, individuals have a little bit more or a little less restriction on their activities. They could still potentially get out of their apartment or their living area if they needed to. That's only on an as-needed basis. We're certainly not going to encourage them to do that. We would, so let's say they needed to run to the store and there was no one that could do that for them, but it was something that they absolutely needed to get. Then that would be possible. Someone that's in isolation, we wouldn't want them to do that because we know they're infected, and having them get out in the community just increases the likelihood that they may come in close contact with someone else, and then it puts them at risk. So the quarantine restrictions are not as significant or severe as what the isolation restrictions are. Anytime that we tell someone they need to be in isolation or quarantine, we will provide them information sheets from the CDC that describe it. It kind of defines and outlines what's expected in isolation, or defines and outlines what is expected in quarantine. So patients have that information.
So when a student is told, let's talk about a dorm student who's going to be going to one of our isolation spaces, what should students pack? So they need to bring with them a couple of weeks worth of things: their clothing, laptop, school needs, medications, snacks, drinks, enough for 2 weeks. The university will provide a self-care kit with linens, thermometer, face coverings, gloves, disinfectant wipes, and hand sanitizer. But it's really important that you pack everything that you need. Your card access to your dorm or sorority house will be shut off for the period that you're isolating. So another question we've gotten is, how will I get from my dorm to the isolation housing? If you need transportation, the university will provide it. A staff member will give you the information you need to arrange transportation, and someone will come and pick you up and take you there. Another question is, well, how will I know where to go? A staff member, again, will give you information, including your self-isolation space location and instructions for picking up a key at Magnolia Hall. So we've updated our procedures about that. Let me just speak, and if there are parents on the line, I want you to hear this. No one, if a student discovers that they got a positive test result back and it's 8 o'clock at night, we're going to ask them we will transport them the next night. So the next morning, we will not be transporting anyone after 7 p.m. at night. Another question is, if I'm in isolation or quarantine, I'm a dorm student, how will I get my meals? Well, one of the resource contacts for students is dining service, and we will arrange for you through dining services meal delivery. Dining services will deliver meals to students' rooms, which are equipped with refrigerators and microwaves at a minimum. Some of them have full kitchens. Meal delivery occurs between 11 a.m. and 7 p.m., and you will receive 3 meals during that period. There will be no contact deliveries there will be 2 no contact deliveries in a day. One with lunch, I just was wrong. I'm correcting myself. One with lunch and a second with dinner and the next morning's breakfast. When deliveries begin at the start of your quarantine or isolation, it depends on what time you call to make the arrangements. We have expanded hours, and students can now call up till 5:30 to be able to get dinner delivered. If you're living in a fraternity or sorority house, have a meal plan with the Greek organization. Arrangements for meal delivery are done with the individual chapter houses. So that's different than those living in the dorm. So what about this, Dr. Greg? Will anyone check on me when I'm in isolation? What happens if I'm not feeling well?
Well, this is an important caveat that I think everyone especially one that's in isolation and is ill, needs to be aware of. It's incumbent on me as a patient, if I'm not feeling well, to reach out to my healthcare provider for medical advice. And so through the Student Health Center, what we tell all of our patients is, if at any time you're not feeling well, you need to contact the telephone triage nurse, or we'll often give them our own nurse's telephone number so they can contact us at the office. Anytime that a patient is not feeling well, they don't need to wait for someone to call them. They need to get on the phone and they need to call their healthcare provider, discuss their concerns with them, and get a plan of action set forth. Now, individuals in isolation will be contacted by a contact tracer periodically. Also, those in quarantine may be contacted. We prioritize those calls. Those individuals that we know are more symptomatic are going to be called. Those that are quarantining and are fully without symptoms are going to be called less often. But we're still encouraging students, anytime that you are symptomatic, and this holds true for employees as well. anytime that you're symptomatic, you feel like you're developing new or worsening symptoms, it's imperative that you get in touch with your healthcare provider and discuss that, because we know that there are many episodes where COVID can rapidly progress. And so it's very important that you get in touch with your healthcare provider to discuss your symptoms.
So Dr. Greg, question. So if I'm self-isolating because I tested positive, how do I know when I can get out?
Typically, if it's, let's say there's some cases that are kind of cut and dried, so to speak. We've got someone who develops mild symptoms. We know that they were in close contact with someone else that they may have gotten that from. So and then we get a positive test result back. We know without a doubt that individual is typically going to be in isolation for a period of 10 days. And the contact tracer and your healthcare provider should make you aware of that from the start. Now, if things change during that, obviously your time in isolation could lengthen. We know that anyone who's a close contact of someone that has COVID infection is going to quarantine for a period of at least 14 days. There's really no options in that regard. That quarantine time is pretty much set. Usually what would happen is if you develop new or worsening symptoms, you're going to get in touch with your healthcare provider, and they're going to let you know if your isolation period may be extended. They're going to tell you if you need to come back in and get tested, or maybe even need to go to the emergency room if your symptoms are significantly worse. When a contact tracer gets in touch with you, that's part of what they're doing as well. Not only to make sure that you're maintaining yourself in isolation, that you're doing the things that you should do while you're there or in quarantine, but they're also calling to make sure you've not developed some new or worsening symptoms. What they're going to tell you to do is if you have developed those symptoms, get in touch with your healthcare provider. That's key to getting the care that you need.
So one last little group of questions, Dr. Greg. Let's talk about students who are off campus, isolating, quarantining. We've had some questions about that. So what do I do? What does this mean for my roommates? How does this work? I'm in an apartment. I got 3 other roommates.
So what we typically would do, we would have those students complete a self-isolation form. A contact tracer would be in touch with the individual. Let's say that someone is self-isolating because maybe they went to the health department or went to a walk-in clinic somewhere, and a day or two later they got a call and said, hey, your COVID test that you had performed here came back positive. So that's going to be reported to the Knox County Health Department. The health department's going to reach out to that individual that's positive and get some more information from them. One of the first questions they're going to ask is, are you a UT student or a UT employee? If the answer to that question is yes, they're going to advise the student or the employee to go online and complete our self-isolation form. That's what's needed in order to get a response from our contact tracers here. Additionally, the Knox County Health Department will contact us and let us know that you have been identified as an infected individual. When our contact tracers reach out to you, they're going to inquire about where you've recently been on campus, who you've recently been around, who are your possible close contacts. If you have people that are living in your apartment with you, you can pretty much bet they're going to be a close contact. So you need to let that contact tracer know who your roommates are. And if those roommates are employees of the university or students at the university, they need to fill out a self-isolation form. That is the way that we're able to get a handle on the number of students that are infected or are having to quarantine because they're close contact. What's key for that individual in isolation in their apartment is avoid contact with your roommates. The longer that you continue to have contact with your roommates or suite mates or people that live in your home, the longer those individuals are going to have to stay in quarantine. So let's say that I'm placed in isolation for 10 days. And every day my wife is coming into my room and checking on me. And we're having contact. She's providing food to me. She's taking out my trash. We're having close contact every day. Then at the end of my 10 days isolation, I can go back to work. But my wife, she has to stay at home for another 2 weeks because the last day that she was exposed to me was on my 10th day. So now she's been essentially in isolation or quarantine for 24 days instead of 14. So I think what's key is if you have to isolate in your apartment, you need to stay away from your roommates. Stay in your room, use your own bathroom, avoid simultaneous use of any shared living spaces.
Will anyone check on me? I mean, anyone from the university?
I'm sorry, I didn't, can you say it again?
If I'm isolating off campus, is anyone going to check on me, like from the university?
Yes, there should be 2 points of contact for you. One is if you've seen a healthcare provider off campus and not through the student health center. And I would remind you that most of our students live off campus. We only see about half the students that attend the university through the student health center in any given year. We average around 30 to 40,000 visits each year, but only around 15 to 16,000 students actually utilize the student health center. So we've got another half of our students that get their care elsewhere. If they're receiving their care through a local provider, that needs to be their point of contact for their health care. And then the contact tracers from the university will get in touch with that individual just as they do for those that live on campus.
Would it be better if I just went home? If I live off campus, what would you say?
Well, I think it really depends on what your home situation is. It may be safer for you to stay here, especially if you have someone that lives at home that's maybe getting chemotherapy, has some chronic lung disease. It really depends on, if those individuals get sick from COVID, how much more likely are they to have a bad outcome in that regard? So if people at home are healthy, there's a place there where you can isolate, not be around other people, and not have that close contact, then that might be ideal, and your roommates certainly might appreciate it.
Okay. Well, thank you for that. And I hope that helps clarify for folks how important it is to take isolating seriously for our off-campus students. Now I want to switch gears a minute and talk about, we did finish the first week of classes successfully. I walked around campus and saw students in classrooms myself last week, and it was inspiring. I'm teaching my own class tonight for the first time. To our Provost Zomchik, any reflections on the first week? Anything you would just highlight that you saw or heard about?
Thank you, Chancellor. Yes, we are offering over 6,100 unique sections of classes this semester. Given that large number of classes, we've had a remarkably glitch-free beginning to our fall semester. When problems arise, we've been attending to them, and we've been attending to them through our Office of Information Technology or through our academic success teams. One of the questions that I have been getting is if a student does need help, where does the student go? We've been getting these questions, especially from parents of our first-year students. So the answer to that question is it depends on the kind of help that's needed. If it's a problem with technology, the student should call 974-9900 and get on the OIT helpline to see if they can help them with their technology. If it's a problem with the individual class or a question about the individual class, the first place of resort, the first person to resort to is the instructor. Reach out to the instructor and seek help from the instructor. But for all of our first-year students and our first transfer students, this year, for the first time, we have something called a Vol Success Team. The Vol Success Team consists of 3 staff members who are there to help the student navigate the campus and navigate the processes of the campus. There is an academic advisor, and the academic advisor helps the student with their career goals, with their course scheduling, with thinking about majors, minors, things like that. We also have academic coaches, and the academic coaches help our students to maximize their strengths, manage their time, develop study skills, address motivation and goal setting, and most importantly, directing students to a large array of resources that we have here for them to help them succeed. And finally, if the student is having issues with financial aid, with their accounts, or with enrollment, they can contact One Stop, our One Stop counselor. So there's a One Stop counselor that will be assigned to them. Each team will follow the student over the course of his time with us here. I also want to say, sort of following up on what you all have been saying about staying healthy during this pandemic, our faculty have been instructed to tell students who have forgotten their mask or may not remember that it's not on to wear the masks in their classrooms. Students are required to wear masks in classrooms. And so please, students, as you come into the classroom, make sure that that mask is up.
Thank you, John. And if the student doesn't have the mask on, we've asked the instructors to ask the student to leave. So that's really critical. So I want to again thank everyone. The vast majority of our students are doing their part to protect themselves. I hear from them. They write me. They speak to me on campus. I'm frequently out on campus, and I'm so pleased with what I see on campus. We are actively watching the numbers and the behavior, and we will respond to both of them. I want you to remember that the website is, the dashboard is updated at the end of every day. So we encourage you to keep watching that. Let's all watch the numbers together. I appreciate so much all the hard work of faculty and staff. Everyone is putting in just 110% effort into making this semester successful for everyone and for our students. This is uncharted territory. There's no guidebook for how to do this. We're all figuring it out together, and I continue to have great confidence in our ability to see our way through a healthy semester where people can complete what they came here to do, and that is progress towards a wonderful University of Tennessee degree. So I want to thank everyone for being on the call, and I look forward to speaking with you again on Friday. Go Vols.